The following program is a specialty program. Unless otherwise identified, the participants on the program are not employees of Chorus Entertainment. Opinions expressed may not necessarily reflect the views and policies of Global News Radio 640 Toronto.
Or it could be the PinPoint Health Show. It could be. I'm just throwing it out there. Savan's got to wait, okay? He's going to wait. He's going to stay.
I'm going to backcharge Savan for that.
For the entire year. PinPoint Health Show. Dr. Lou is ready to go. Of course, it is 416-870-6400. That is the number to call in. You have health concerns. You probably do. Something bothering you. Something you've always wanted to know. Call Dr. Lou now here on the air for the next hour. 416-870-6400. PinPointHealth.ca is the way to book an appointment through one of the clinics. They're open. They're rocking. So make sure you take care of that as well. And you can always check out the Lou Down. That would be the long-form podcast. Morning, pal. How are you?
Good morning. I'm well. How are you, John?
I'm good. It's sunny, a little cool, but it's a nice day out there. What are we covering today?
Well, I mean, since it's the disability show today, I it's funny enough, that is a realm that I work in as well, and my company works in when it comes to, things like assessments for car accidents and disability claims, and obviously treating these people that have been hurt in these things at the clinical level. So, it is something that we do very much. And if anybody, my favorite part of this show is the phone call. So if people are dealing with these types of things, not the legal side, but the health side of things, if you've been injured in something and are wondering sort of, from a healthcare perspective, how you should be navigating that space and what you should be doing to get better, I'm happy to take those calls as well and help try to answer whatever questions listeners may have. But it is something very much that we see. And, last week we were speaking about spine-related pain, and when it comes to car accidents and slip and falls and things like that, I would say the vast majority of things are actually spine-related issues that end up as a result of those types of injuries. So again, very much something that is part of the repertoire of what PinPoint Health offers. Car accidents, when people are hurt in car accidents, these types of claims. And here's the thing about that. People don't realize the amount of force that happens in these things and the effect on the body. And it's quite tremendous, right? You've got to understand that you've got force is mass times acceleration. That's the physics of it, right? And when you've got these massive machines, these cars, SUVs, whatever you may be in, and there's usually two of them involved, and you've got all this mass and at an acceleration that, whatever it may be, there's a lot of force that ends up getting transferred from the vehicle into your body. And that's why people sustain injuries. And it's interesting because, obviously in the beginning, you want to make sure that there's nothing wrong from an emergency standpoint, which is obviously number one, right? You want to make sure there's no spinal cord injuries, hemorrhaging in the brain, anything like that. So that's typically when, ambulance is first on scene and the paramedics, they'll do their best to assess that. If they think you've got to go to the hospital, they'll make that recommendation. Otherwise, you should follow up with your healthcare professional. And even if you otherwise feel fine, what people often don't realize is sometimes it takes a few days for the issues and the pain that's associated with it to actually set in. And in all honesty, I've seen it take even longer than that. Sometimes it could be weeks and months later where there's all of a sudden an effect of what happened starts to set in. So it's not something, I really always try to encourage people, when unfortunately they're in an event like that, you do need to go get checked out and get your musculoskeletal system assessed properly, because you want to make sure that you're getting these things early. We know really well that, as you leave these things for too long, chronicity will set in. And, again, something that I've hammered home on this show a million times, once chronicity starts to set in, you're dealing with a whole different monster. And it's really, really important to do that. And, there's a lot of emerging research in this area of, call it like, let's say the car accidents, the insurers in this and those types of claims. Oftentimes you hear a lot of times people will be hurt in these accidents, and right away, where are they going? They're going for just simple massage or, passive type of therapy or whatever it may be. And again, research is starting to emerge that shows us that actually you've got to get, moving with rehabilitation almost right away in order to really prevent that chronicity. So there is a proper approach to these things. And, oftentimes what just feels good, like, listen, John, everybody loves a massage. I love it. You love it. But that doesn't always mean that it's the right thing for the long-term prognosis of what you've got going on. And I'm also not saying that massage therapy doesn't play in a role. We offer massage therapy. It absolutely plays a role in conjunction. And too often we see people who have been hurt in car accidents or disability claims, and you see them a year and a half after their injury, and all they've done is passive interventions, right? And it's just something, I go get this done to me or I go get that done. And once you start to investigate and say, well, how much exercise are you doing? How much rehabilitation? Oh, I don't do any of that. And oftentimes what they end up saying is it hurts too much. And this is the point of healthcare where you've got to educate someone on the difference between hurt and harm. Some things can hurt you in your journey of getting back to health, but they're not necessarily harmful. Vice versa, you can have things that actually don't hurt you at all and are actually very harmful. And a good example of that is like chronic low back pain due to a mechanical cause. Oftentimes people, we try to get people, we give them core strengthening exercises, and people will say, well, yeah, but after I do it the next day, I feel sore, I'm in pain. But that's delayed onset muscle soreness. That means you're getting stronger. So there's a hurt associated, but there's no harm in that. That's actually a good thing. Versus you not doing anything doesn't necessarily hurt you, but is extremely harmful for the long-term management of your back pain. So it's really, really important that, especially in these types of things, we sort of started talking about these types of accidents where there's, a level of trauma that's involved. You really got to get on that as early as possible. And I know, unfortunately, not always, but a lot of the times these things become more legal than they are healthcare related. But I really encourage people anytime that they're hurt, priority number one should be getting better, because I've seen all too many cases that don't get better, and really there's some simple things that you can do from the get-go that can almost ensure that you do get better.
Again, 416-870-6400 is the number. Yeah, it's interesting because people will often, to your point, they'll have a bit of what they seem would be a fender bender. They feel fine afterwards. Maybe, there's adrenaline going through their body and they don't feel, it's okay, I'm fine, I'm just going to go home. And then 2 months later, something creeps up, and for the life of them, they can't remember whatever would have caused this because they didn't feel anything in the day of the accident. They figured, no, that couldn't be it. That was 3 months ago. I would have felt that right away. And that goes down the whole road to leading problems that could be long-term, right?
Yeah, absolutely. And again, you've got to consider that we have, human bodies, and in these types of events, there's massive force that's being transferred into our bodies. And a lot of the times it's no different than, say, repetitive type of work where, someone will say, like, I oftentimes will see people and, they do some type of repetitive work constantly. And they'll say, yeah, but I've been doing this for 10 years, so it can't be that. Well, it's like, it's the ongoing trauma of it that may be actually what's causing it. And no different than a car accident or some type of massive force like that. It can set off, a precipitating event, something that happens in your body that, yes, you don't feel immediately right away, but then combined with everything else that you're doing in your life, which none of us are perfect, right? Like we all have poor posture and things like that and repetitive things that we tend to do. And you combine it with that. And then all of a sudden, yeah, John, like you said, a few months down the line, you start thinking like, gee, I've never had back pain before and I've never had neck pain. And then all of a sudden I'm getting all this neck pain and back pain. And, I can't think of anything else that's been different in my life. That's why getting it taken care of early, whether, a lot of times from a clinical perspective, we can pick up dysfunction even if there's no pain, right? And that's a big thing. Like, pain is an important indicator to make people realize, I should go see somebody. But that's not always necessary, especially if you've had a trauma, right? Like, you might think that you're pain-free and that you're fine. It's not going to hurt to go get checked out and just get, assessed from a functional standpoint and see what's going on. And a lot of the times, if you're seeing someone who's been involved in something like that, like if I'm seeing someone who's been involved with that and they're overall asymptomatic, but I start to note some things, really a lot of it is just the encouragement to be as active as possible, right? And with some specific guidance in terms of what that activity should be for that particular person. And as a consequence of, you've got to look at the type of accident, the acceleration that was involved, where you rear-ended, where you hit from the side. That will give us an indication of what things might happen. Were you a passenger? Were you a driver? All of these other things. So it is very, very important to make sure that you get these things, again, checked as early as possible. See someone who can, assess the musculoskeletal system and determine if there's anything there that needs to have further investigation or at least some therapeutic intervention.
The phone number, by the way, 416-870-6400. You want to bring on your calls if you're having any sort of issues of your own. That's why we do the show here every Saturday morning. Safety is a great thing, and cars have, every year they're getting safer and safer with all kinds of equipment and technology. But it's almost like this pod of insulation people feel, it's like they're not that they've been desensitized to it, but if you go back to a car when, you and I were kids in the 70s and early 80s, I mean, man, it's, you could hear everything, feel everything. Now it's like, it's like a hotel room on wheels. I guess it's a good thing because it's safety, but at the same time, it almost gives you a false sense of security in some ways. You know what I mean?
Yeah, for sure. And I definitely think that the way things are built now, and I'm by no means a car expert, are definitely safer in terms of preventing fatalities, for sure. But the reality is, the musculoskeletal consequences that you're going to feel, I don't know if that's changed as much. And I'm not saying yes or no. I'm genuinely saying I don't know. We see a ton of people hurt in car accidents. And yeah, I think probably the safety features have helped a lot with the fatality. Like, when you watch those videos of them crashing it into a wall, right? The person survives, but you see what happens to their body in the midst of that with those dummies, right? Like that's not what our bodies are meant to do. That's a lot of force and trauma that gets, taken into your body. And that is going to have an effect. Like I can promise anybody no one really walks away completely free from these things. That has an effect whether you realize it immediately or you don't.
416-870-6400. Take a quick break. We'll get to your calls as soon as we come back. 416-870-6400. The time is now to give us a call, info@pinpointhealth.ca, through email as well. We'll continue. Pinpoint Health Show. This is Global News Radio. They don't realize that they are still doing those sort of things, right?
Oh, yeah.
Just like your clinic is still servicing people.
Some of it never really stopped.
Yeah, some of it never really stopped, right? So,
yeah,
all right, where are we going, pal?
Yeah, again, one of the things that I've started, we're going to sort of shift gears here, that I've introduced into my practice over the last few months, which I think has been getting a lot of great feedback from listeners that have gone so far as to try this out, is the genomic testing that I've spoken about before. A lot of people are reaching out, wanting to get it done. I've sort of said on the show that this is not a diagnostic test. This is very much more informative. So if you want to get sort of a sense of who you are from a genetic perspective, want to get an understanding of things, this could be something for you. It's really good for overall wellness. This is really designed for people who are looking for sort of something more to understand, where they might have some predisposed problems, the things that they can do. And a lot of people are finding it very valuable. And I've now done, dozens and dozens of consultations with people that have received their results from the genomic testing to go through sort of that stuff. And it's been eye-opening for a lot of people in terms of understanding some of the things that they should or should not do. Like, the test won't specifically tell you, as an example, what you should eat and what you shouldn't, but obviously based on the results, you can infer sort of things that might be better or worse. And, one of the sections of that test is cardiovascular health. And, in some people who I've been able to sort of infer based on the results, they're more resistance training right now and only doing that stuff. And yet, their results come back and say, you're at some risk for cardiovascular disease. And then all of a sudden we're including some aerobic type of exercise in their overall lifestyle routine, just really to, again, provide some benefit in terms of protection against that, right? So, and that's good because it helps people to stay motivated on, okay, I know why I've got to, cycle 3 times a week or why I've got to do that. Even though I've never done it in the past, I now see the value in that. Another aspect of it has been people trying to understand where their diets should be in terms of, not diet in terms of how do you lose weight, but what is it that you should eat that's beneficial for you? And, from a very high level, we can identify whether, with starch metabolism, you're predisposed to weight gain, or with fat metabolism, and that can really help to shape the type of diet that you have. So that's a very, very powerful thing in anybody sort of trying to improve their overall wellness.
And it's not the type of thing, I know you like to reiterate the fact that this is not finding out who your great-great-grandfather was in Estonia back in the day. It's not that type of testing. It's purely from a physical nature, and it's to set you down the path of things you maybe could be changing daily in your lifestyle to to increase your health, really what it boils down to, right?
Yeah, your overall wellness, exactly. And, the test is really broken down into 4 big categories. So they look at the genomics, a bunch of genes in the area of mood and behavior. So you get sort of this mental health understanding. Again, I like to use my examples, but you can find out whether you have this type of worrier attitude or warrior attitude, which, a lot of people probably know that anyways, because you know who you are. But this helps to understand why you might be a certain way. And within it, there's also, the test gives you sort of, tidbits of information, like one particular gene, if there's an expression of that gene, then maybe SSRIs, which are a class of antidepressants, may not actually be beneficial for you. And so, that's not saying that you should or shouldn't take it, but it's information that at least you can provide to your primary healthcare providers and say, well, based on my genes and the research, it says that, this might not be beneficial. Maybe you go down a different path. So mood and behavior, there's the cardiovascular health that I spoke about. There's a methylation report, which is essentially how things happen in your body, the different breakdowns from a biochemistry standpoint, which is very, very important. And that can give you an idea of sort of which vitamins might be more important for you or not. And then finally, the metabolism report, which is the one thing that I would say most people seem to be most interested in, is sort of understanding, what their metabolism is like and what it is that they should or should not be doing to really help that. And so, again, for anybody looking for an overall wellness report, just to give you that extra boost or that next step, I think there's a lot of value in it for sure.
It's really amazing to me too that it's one thing to do a genomic testing this and find out, okay, if you're a carb person or a fat person, that's purely the physical. But the warrior versus warrior, I mean, that's totally a personality, mental thing. And whoever thought that from a saliva test, a simple saliva test, you could boil down that type of information. That fascinates me more than anything about this entire test.
Yeah, listen, and that, sometimes they're made like, it may not be of value to you per se, but as an example, like I know mine, I had more of that warrior type of genetics, and I sort of knew that about myself. I've had, some stressful things happen in life, and I sort of know how to tackle it, and I realized that I could tackle it. So, it doesn't really provide me much added value, but where I found benefit to it is, I have young kids, and I want to know sort of where their mental and mood disposition might be, right? So that way you can sort of help set them up for the right way. It's not better to be a worrier or a warrior, right? This isn't like one is superior to the other, but it is better to sort of know how you handle things. And, even more so, me being a warrior, as an example, if my son turns out to be a worrier, if I don't know that information, I probably have a level of frustration where I'm like, I don't get it. You're not doing this the way I would. And really this helps you to realize, hang on a sec, like you may not be the identical person you want it to be, and you might have different genetic predispositions. And now all of a sudden that can sort of help relationships in a way, right? Like, and this is what I mean, that this is not diagnostic. It's more of an educational thing where you can infer certain things. None of this is absolute in terms of like, that your kid, if they're more of a warrior, or a warrior, that they're not a warrior or that they don't have some of those traits. I think it could provide some overall value, and it's provided value in my life and my family's life, and the other people that have come through and had it done have found it to be beneficial for sure.
Let's take a quick break here. We'll give you some time to regroup and grab a phone. If you got a phone call, some physical issues, something that's been bothering you, you know what? Just ask. It's really that simple. 416-870-6400 for the remaining time here this morning. It's just 11:35, so you got tons of time to call in. 416-870-6400, info@pinpointhealth.ca. And don't forget the long-form podcast, the Lou Down, available where you get your favorite podcasts as well. Pinpoint Health Show, Global News Radio. It sure is. 11:37 here. Lots of time for you and your concerns, health concerns. Bring them on. I'd love to talk to you this morning on this lovely Saturday. It's 416-870-6400. info@pinpointhealth.ca for email. And to reach out after the show to Dr. Lou or one of his team, 1-855-55-DOCTOR-LOU, DRLOU. Genome testing. I love this thing. It's quite simple, too. It's not very invasive, is it? It's simply a saliva test. It gets sent away, and then the information gets back to you, and then you kind of dissect it with the patient, correct?
Yeah, it's as simple as it gets. There's a saliva-based test that's actually mailed out to you. There's instructions, obviously very simple. And then, there's a way bill that's sent out. It gets sent to a lab at McGill University where the genomics are run. A report is created because it's informative. It's actually sent directly to whoever the person is that is the person providing the sample. So there's nothing in this that says you have to follow up with me, right? It's purely information. It's a pretty extensive report, so they do a good job in providing information. Most people that see it, I would say like almost 100% so far. I can't think of anyone that's opted not to go through with it with me just to have sort of a professional's opinion on it. But it's not absolutely necessary. And yeah, it's a very simple test. Again, really good if you're looking for an overall wellness boost and information about who you are and, again, who your family, like, your kids, your loved ones, some of the things that might be risk factors for them. Again, some people know they have high cholesterol, right? Like you don't need to have a genomic test to tell you you're predisposed to that. But you may have kids and you're wondering, I wonder if they're predisposed to it. And if they are there eating patterns for the family that might be better if you adopt a certain type of diet approach that limits that and get them, thinking of that from a young age. That I think is a very, very powerful thing, right? You may sometimes, and a lot of people have called in for this where it's like, they know it might be too far past for them, like in terms of knowing, because they already know sort of what they have. But does it help the younger people in your family that you might be, worried about or know some of the things that are prevalent in the family history? And this is a way to sort of check out is that the case? Are those genetics actually there? Because it may not be. And I gave one of the examples that I used, which was beyond shocking to me to find out, was everybody on my dad's side, like everybody has diabetes. And so, I've always sort of adopted the approach of a very low carb diet, exercising, all that stuff, just because it's something that I always wanted to prevent because I saw, what it did to him and his brothers and his sisters. And, all of them have passed since they've had it, but the consequences of it were very ugly for me to see. And I sort of was in my mind, like, I want to do everything that I possibly can to stay away from that. And so, I did all of those things, but in my mind, I always thought, no matter what I do, I'm probably going to get it at some point just because of the genetic link to it. Gotcha. Well, I have this test done, and one of the things it looks at is insulin resistance, and if you and that's what diabetes is type 2 diabetes, anyways. And it turns out I'm actually at very low risk for developing type 2 diabetes. I have sort of the more optimal genetics, which I got from my mom's side, and that didn't change anything for me in terms of like I'm still on. I've always tried to do a low carb diet because I think there's value in it. Because again, just because you don't have the genetics doesn't mean you can't get it. It is very much a lifestyle type of disease. But what it did do for me is sort of reassure me in the back of my head, thinking like, gee, you know what? All this stuff that I'm doing, actually, like, I'm not actually doomed no matter what. Like, I have a good chance here. If I could do the right things from an environment perspective with my diet, my exercise, and genetics are on my side, well, then, as long as I continue down the right path, I could really do something to prevent me from ever getting that. And to me, that was such a powerful thing to know because, again, I always sort of in the back of my head thought like, gee, no matter what I do, I'm going to eventually just be doomed and get diabetes. But this was really reassuring and again, incredibly surprising to me, just because, again, the family history that I have would have suggested that, yeah, I probably have those genetics. But, clearly I somehow won that genetic lottery and had some stuff there. At the same time, cardiovascular disease, which was prevalent in both my mom and my dad's side, well, to no surprise, I'm at risk for that. So again, that doesn't necessarily mean anything more than I just make sure that I do the best that I can for my cardiovascular health. And this is where me being a healthcare professional, I know what those recommendations are, right? Like eating a well-balanced diet, fruits and vegetables, antioxidant stuff, making sure to include cardiovascular exercise. So running, cycling, those types of things into my overall week versus just focusing on, what the typical guys do, which is just resistance training, just lifting weights. And so there's huge benefit in knowing that. And for me to really say, okay, and again, that's something that I pretty much knew just because of, again, the prevalence on both sides. But this really, solidified it for me where it was like, okay, no, I know that I have the poor genetics for that. And so I've got to stick to that. Now, where I can take that one step further is my fat metabolism in terms of the fat consumption is actually incredibly good. It doesn't translate into weight gain, which is a good thing, whereas starch metabolism is actually not good and does transfer into weight gain. So likely, I also need to be on sort of a very low-carb diet that is higher in fats and proteins, which, again, is something that I've done for a long time. I inherently knew that was the right thing for me. But now I don't ever have to guess about it again, right? Because there's been times where I've said, maybe I should go more on a vegetarian type of diet. But a vegetarian diet can actually be quite high in carbs because when you're limiting a lot of the proteins, then you really focus so much more on the carbs. And it turns out the answer for that for me now is like, no, you shouldn't be on that. That actually is not going to help you and may actually be detrimental to the cardiovascular health and all that stuff. So now I just focus more on a diet of proteins and healthy fats, of course, and some carbohydrates. Obviously, I don't completely eliminate it. There is value, and my starch metabolism was moderate, so it wasn't the worst that it could be. So, that's sort of what I took away from it and was able to sort of solidify my life plan in terms of what my exercise routine should be, what the diet should be. And now I don't, again, ever have to, in 10 years, I don't need to say, well, I'm going to try this different diet or this different approach. It's like, no, these are my genetics. That's what I'm going to do.
And you found, like, even though it was a personal test for you, I mean, there's enough in there that give you the heads up to say, oh, maybe, my son who's very small at this age, maybe this is something he should be looking out for. Or, I mean, what age can you really start doing this test? I mean, it's it's not invasive at all. It's just spit.
No, it's not invasive. It's a good question. I would say, like, for me, it's like, I would think that if you're in your teens, right, like early teens, that's a good time. And I mainly say that because, teens might actually be like, I can't explain to my 2-year-old son that, he's at risk for cardiovascular disease, so he shouldn't be eating certain things. And I also don't think at that age it matters as much, right? Like, I think it's once you get into your teens and you start becoming an adult where they all have their own reason. They can understand these things and make sense of it and want to do it themselves as well. And I think that's a powerful thing. So I don't know that there's any right or wrong age, but I would say generally, like, I would think, a teen is probably where is a good place to start.
It is 11:46. We still got some minutes. If you have any health questions of your own, musculoskeletal stuff, bring it on. We always get calls every morning, people asking, what could this be? That's fine. Bring it on. 416-870-6400. info@pinpointhealth.ca is the email address. And anytime you want to reach Dr. Lou when the show is done, 1-855-55 Dr. Lou. That's the way we roll. Take a short break. Get back to more of it on Global News Radio. All right, 11:49. We are back at it. Still got some time. You want to make a phone call now would be the time. Mary, thank you for standing by for a moment. Good morning. How are you?
I'm good. How are you?
Excellent. What's on your mind?
Well, I was just telling him that my whole life I've just spent trying to figure out how to lose weight and keep it off. Like, I'm 53 right now, 54. I exercise all the time. I watch what I eat, and it seems like nothing happens unless I starve myself. And that's been my whole life. Like, I need to stop eating and I lose the weight. And then I gain it because I know I've done something wrong, right? It comes back. Yeah. But it's just, I just don't know. I just don't understand why it just doesn't come off when I want it to come off and stay off. I've gone to see many doctors. They've helped me. They've taken me off carbs. then slowly introduce them, and then as soon as I slowly introduce carbs, boom, the weight comes back on. So I'm in menopause, like I'm menopausal, like, you know, so it's harder for me now to lose weight. I get it, but I'm just tired of losing and gaining.
Okay. And do you have a specific question, Mary? Sorry.
Well, I was just wondering if that Geno test is right for me, like if I should do something like that.
Well, it could, right? Like, so sort of what I was saying is it could give you a picture of understanding, like, you know, maybe the combination of things that you've been doing are the wrong approach, right? Like, you know, maybe you do have poor starch metabolism as an example. And so, you know, maybe you should never be reintroducing starches into your diet, right? Like that's going to be counterproductive, right? And so, or maybe you should be doing more resistance training versus cardiovascular training based on your overall cardiovascular health. So yeah, we can definitely infer different things from that. And definitely that's what a lot of people are doing. So yeah, it could absolutely provide some value.
Okay.
Alrighty.
All right.
Mary, you want to reach out afterwards, you can do so. Here's the way that you want to do that, because that's the next step, as Dr. Lou is saying. You want to call him at 1-855-55 Lou, DRLOU, and carry on and check out that test. I think it's something that everybody could really benefit from. Dylan, good morning. Hello. How are you?
I have a real simple question.
Sure.
Is it possible to correct bad posture over the age of early 50s?
So if the posture is due to, you know, something that is more functional, like you're just weak in certain areas or too tight, and those things could be worked on, yes, absolutely. If you have bad posture as a result of actual anatomical changes, then, you know, typically the answer would be no. So, you know, some people might say, like, oh, you know, your back looks rounded, but that may actually be as a result of degenerative changes in the spine that have led you to become that way. And, you know, no matter what you do, you're not going to get straight again. But some people may have rounded shoulders. Their spine otherwise is fine, like the anatomical structure is fine, but they have weak muscles, and then their, you know, pecs and other muscles may be too tight. So it depends on what is creating the poor posture per se.
And what type of doctor would I see to test that?
Yeah, so any musculoskeletal specialist, chiropractor, physiotherapist could absolutely help with that.
Great. I appreciate the answer.
No problem.
Thanks, Dylan. Appreciate the call. You want to reach out, Dr. Lou, again, would be a good place to start. That's 1-855-55 Lou, DRLOU, info at PinPointHealth.ca. Still got a couple minutes to go here. You know, it's really interesting. Back to Mary's call. How many people have said that in their lives? I mean, you know, I've tried this, I've tried that, I'll lose the weight, then I put it back on. I'm sick of this battle, and, you know, what's the next step? So maybe, as you said, you know, maybe this genome testing is the way to go for people, because, you know, I've struggled with it. We all have, right?
Yeah, and I think the example that really can, you know, take it home for anybody listening is sort of, and I'm just using Mary's example, I'm not saying this is her case, but using the example of where she said, you know, when she's on that low-carb diet, it works, but the minute carbs are reintroduced, it gets, you know, the weight starts to come back. And I basically said, yeah, but, you know, if all of a sudden you're identified to have poor starch metabolism, then we know that that's the reality, right? The minute you reintroduce those things, you'll lose weight. So maybe that's the aspect of it that you need, like that someone needs, is just to be reassured to say, hey, no matter what, these starches are not good for you. So if you want to keep the weight off, there's no reintroduction of it. It's just an elimination of it. And you've got to keep it eliminated. But that could be a powerful tool if you know that's the answer, right? If you know that's the answer genetically, then, you know what to expect the minute you start and I know it, like, John, I knew my whole life that the minute I reintroduced carbs, I would gain weight. But the minute I had that test, it's not a surprise to me now, right? Like during the holidays, obviously, you know, you have more carbs and stuff like that. And I gained weight, but I knew because I was having more carbs. There was no surprise. I was still working out. I was doing everything, but I know that I have moderate to poor starch metabolism. So guess what? The minute I reintroduce that stuff, that's not going to be good. It's going to create weight gain. And there's no there's nothing around that. There's no like, well, what about, can I just have a little bit, or can I have, it's like, well, no, if you can't metabolize it well and it leads to weight gain, then you should just eliminate it.
Yeah, I mean, it's just the way to go for a good start. Anyway, some final words here for a couple minutes, what people should do now that we've talked about this genome testing a little bit from now on. This is something they shouldn't hesitate to do, right?
Listen, it doesn't hurt to have a conversation. Give me a call, 1-855-55 Lou, DRLOU. What we'll do is I'll just get a sense of what you're thinking of this for, if it's just mainly, and everyone that I speak to has something different. And, there's been some people that I've spoken to that want it more as a diagnostic test. And I say, no,
yes.
this is not the right thing for you. Here's what actually you should be doing. But anybody who's considering it from a wellness perspective and trying to, Mary is a good example of somebody that I would say, yeah, I think this could benefit you. I think you might find some value in it to know exactly what's going on. I mean, I can't guarantee anything. I can't guarantee that someone finds benefit in something. But again, I base my judgment based on evidence, and evidence includes scientific literature and the experience that I'm seeing with the patients that I deal with. And, people are finding benefit to it. They're happy with the results. They're not per se what their results are, but what level of understanding and information that provides for them for their overall health and wellness. And that's a good thing. That's what this whole thing called health and wellness is about. It's about getting to the bottom of it and doing the best that you can for who you are specifically. And that's why I really like the genomic testing, is it gives you a picture of who you are as an individual. This isn't something like you're trying to apply a diet to 100,000 people and it'll work for everybody. I've always sort of said that's not the approach. You've got to tailor your health and your wellness individually, and what better way than to know what your genetics are.
And that'll do it for another week. Well said. You want to reach out to Dr. Lou, get more information about that genomic testing. That is how you do it, through Dr. Lou, 1-855-55 Dr. Lou, DRLOU, info at pinpointhealth.ca. And a reminder that the clinics are open. They're working. They're helping you. And you can find one near you. Simply go to the website, pinpointhealth.ca. And we'll catch you next weekend right here, same time, Pinpoint Health Show on Global News Radio.
The preceding program is a specialty program. Unless otherwise identified, the participants on the program are not employees of Chorus Entertainment. Opinions expressed may not necessarily reflect the views and policies of Global News Radio 640 Toronto.